Hey guys, it's me and Sabin. I had my pre-op appointment yesterday, so I just really quickly wanted to update and go over what happened, all that kind of good stuff. We are 1 week, 6 days from surgery now, so we're getting to the closer side of surgery. And I'm really more excited right now, and I'm sure I'll get nervous closer to the surgery date. I went in at 3:30 yesterday for my appointment, and everyone was just so welcoming going in. Like I said before, everyone at this clinic or center, they're all so nice and very welcoming. And I saw my nurse as soon as I walked in, and she took me back and handed me a packet of things to read over. Of course, I expected there to be a packet to read of all the risks and all that kind of good stuff. I did know most of the risks going in. Like I said, for a few years now I've been looking at this, so I knew most of the risks. The one that took me by surprise the most was the fact that you can get skin cancer, or you're at a higher risk for skin cancer after surgery. I'm not really sure why that is. I chose not to get into it too deeply because I don't want to freak myself out. So that one was just kind of took me by surprise. And of course the ones that say blood clots resulting in death and this resulting in death and death. So I don't really like reading those words, but I do know the risk going into it. So after reading it and discussing it with my husband on the FaceTime, I signed my consent over. So that was kind of painful to get through, a little frightening of course, but the nurse went over my history, my medical history. We discussed things that would start happening as of right now, things that would happen a week before surgery and the night before surgery and so on. As of right now, being 2 weeks away from surgery, they want you to stop drinking alcohol and to really cut down on sodas and stuff like that, and really start pushing fluids like water, juice, Powerades, just because it will keep you hydrated for after surgery so that you have a better chance of recovering being hydrated. And as for me, that's really important. As I'm doing the surgery on a Friday, I'm going back to work the Monday morning after. And the doctor thinks I'm a little bit crazy for that, but I don't have a really strenuous job. I sit at a desk all day, so I don't know if it'll be too big of a problem. But unfortunately, I will have the cast on and the tape on my face, so I hope I don't scare my patients away in looking like that Monday morning. So it isn't going to be a problem, obviously, pushing those fluids. A week before surgery, they prefer that you start washing your body, not with the normal body washes that girls use. They really want you to use like a dial soap, so you're scrubbing for that last week before surgery. I hate dial soap. It makes my skin extremely dry, but I guess I'm willing to do what it takes to be squeaky clean for the surgery day. And of course, the day of surgery and the night before surgery, nothing after midnight. They won't even let you have water after midnight, which that really sucks. I would love to wake up and just have some water just the morning of. So no water that morning, no makeup, hairspray, deodorant, no body spray. I really wish I could at least have mascara or something, just something to make me happy. So no jewelry, obviously, and comfortable clothes. So that was pretty basic. When I went in for my appointment, I really had questions. I know that someone that I saw on her blog who did a rhinoplasty surgery, they had to put a catheter in when she did her surgery. And so I was really thinking, oh my gosh, I do not want a catheter in. Like, is this going to happen to me? We didn't discuss it at the first consultation, so I didn't know if I was in the range of people that would have to have that. So I was like, that was my first question going in. Am I going to have this? And if so, please let me prepare myself. But luckily, my surgery is scheduled for under 2 hours, hopefully from start to finish. So I am not included in the catheter people who have surgeries for 4 hours and plus. So thank gosh, I'm so happy. I don't like them. Ugh, very uncomfortable. Yeah, if you've ever had one, you know exactly what I'm talking about. So I'm very glad that that's not happening to me. And then, of course, that's so immature, but that was my first concern going in, because I didn't know it was even an option. I guess I don't think about the small components like that, so I did not even know, but thankfully it's not a problem. After surgery, they don't want you drinking alcohol for a week, which is, again, it's not a problem. I really worry about eating the first few days afterwards, so we'll have to see how that goes. They tell you only like liquid fluids and stuff. Soup, I'm assuming, smoothies, that kind of stuff. So hopefully my nursey for after surgery will make me some yummy stuff, since I'm staying with a friend the whole weekend after my surgery to have just help with whatever I need. I talked to him about some medications that I take. I take a headache medication, so luckily that doesn't have aspirin in it, so I can take my headache medication. Anything else with aspirin, like Excedrin, you're not allowed to take. So thank gosh my headache medication has no aspirin. I could not get by without it, that is for sure. So the next update that I'll be doing will be after surgery. So as soon as you see the video start, you will see my face just look god awful. I probably will look like a mess. So just a warning for when the next video gets posted. It will just be the night or the day after surgery. So definitely post-surgery, keep that in mind when you look at me and you're like, eh. I did want to go back to the last video when I was talking about my disclaimer about plastic surgery, how it's not for everyone. I didn't discuss the fact that I know people that have noses that look just like mine, and if they're happy with that, that's fine. I see people all the time, friends of mine, that don't have perfect noses, and to me it looks good on them, and they're happy with it, so I'm happy for them. So just because I'm changing my nose, I don't want someone to think who has a nose like mine that their nose is ugly now, because I don't think that way at all. I think after watching my last video, I don't know if I came off in a bad way. I just wanted to kind of get that out there, that if your nose is not technically in society's eyes perfect, and it has the same problems that mine has, like the bump on top or like the low-lying tip, I don't in any way I'm not saying that your nose isn't beautiful and that you shouldn't keep your nose. It's just for me, it's on my face, my preferences. I don't like the way that mine looks. So I don't want to hurt anyone's feelings. If I did, I'm really sorry. I didn't mean to come off in that way. So I really do apologize if it came off in any way that I don't like yours and you should change yours, and that's not at all what I'm trying to do here. I'm just sharing my journey and why I'm doing it, so it can be beneficial to someone someday who is doing this surgery also. So getting back to my appointment yesterday, I had to throw it in there because I just thought about it. So and getting back to my surgery yesterday, just the last final thing, we did talk about what he would be doing. So just going over, I can tell you exactly what he's going to do now. He's going to go in, and it's going to be an open rhinoplasty, not a closed rhinoplasty. The closed rhinoplasty being they just go through the nostrils, and it's not invasive pretty much at all. But with mine, it's going to be open, where they make the incisions in the inside of your nose, here and here, and then one on the bottom, in like a zigzag kind of way, and they, you know, peel it back. And he's going to shave down the top, and he's going to have to break it twice, I believe, and reset the bottom. And then he's going to be taking out some cartilage on the bottom and under here, just so it kind of naturally just does the tip up by itself. Because it, you know, if you look, it does do that down thing that we were talking about. That is just the absolute worst thing I hate about my nose. So that was just quick. He went over to make sure I knew what was going to be happening. So yeah, that's pretty much it I have for this video. So next time will be the day of or the day after surgery. So beware of what I will look like, and I apologize in advance for what I'm going to look like. So thank you guys so much for watching, and I will see you next time.